Ladies and gentlemen, please take your seats. We will begin the plenary in just a few moments. Once again, please take your seats. We will begin the plenary in just a few moments. Thank you.
Good morning. If I can get your attention, thank you so much. Did everyone have a good morning, an afternoon yesterday? Yes? I went to some really great workshops, and I've been hearing a lot from many of you about your workshops, so I hope that you're getting the information you want to get. And I would say I'm going to talk a little bit later just briefly about some of what I've been hearing from all of you in the course of this, but it seems like the level of sophistication and problem solving and so forth that you all are doing has really gone up a notch, and dealing with very difficult problems, but doing it in a much more, in a sophisticated and compassionate and effective way. So thank you, and thanks to all of you for being here. We have several speakers this morning, and we're going to start off, if I may, by introducing Amanda Enderi, who's the Executive Director of Funders Together to End Homelessness. Funders Together is a great partner with the Alliance and with the conference, and Amanda is a great friend and leader, and we're very happy to have her with us this morning.
Good morning. Thank you, Nan. I consider you a friend and a mentor, and I appreciate the space that you allow for us to wrestle with important and difficult conversations. I have the honor of serving as CEO of Funders Together to End Homelessness, a national network of more than 240 foundations, United Ways, and individual philanthropists who are working to end homelessness by investing in best practices, addressing structural racism that leads to homelessness and housing insecurity, centering and prioritizing people with lived expertise in solutions, and engaging in advocacy and policy change. When asked to give perspective on where philanthropy is headed in the movement to prevent and end homelessness, I realized I would be remiss if I did not honor a leader who has shaped a dramatic shift in how funders approach their investments. As many of you know, or maybe you're finding out now, Janice Elliott, the executive director of the Melville Charitable Trust, announced she will be retiring at the end of the year. She has been a trusted leader in the movement for over 30 years. She's the current board chair of Funders Together, a mentor and a friend to many, including myself. Melville is the only national funder focused exclusively on housing solutions and ending homelessness. Janice has left and continues to leave a mark on the trust and the field of philanthropy. When I see funders across the country devoting more resources to advocacy, policy, and now community organizing, I know it is because of Janice and her leadership at Melville. When funders start to not just invest in policy change, but use their voice to advocate about what can and should be, they look to Janice. When I feel a shift in philanthropy, sharing and giving up power to center the voices and expertise of people with lived experience, I know it's because of Janice. When funders are not just looking to support individual programs, but care deeply about changing the system to prevent and end homelessness, I know it's because of Janice. As we all move to finally center racial equity and housing justice, and funders begin the painful learning to action journey of how historic and structural racism got us here, I know they have looked to Janice, who has been on her own journey with her board, staff, and grantees, to say it is not enough for philanthropy or any of us to be quietly non-racist. We must be anti-racist in our voice and action. Janice also supports leaders and knows that for philanthropy to be effective, they have to invest in the vision of bold and innovative leaders who disrupt the status quo daily. When funders start to break down their own silos, and when leaders in philanthropy say to those funding in criminal justice, education, health, we are all housing funders that should be committed to housing as a human right, I know it's because Janice's leadership led to the creation of Funders for Housing and Opportunity and a movement to bring a multi-sector, multidisciplinary approach to address housing insecurity in this country, and at its core is focusing on racial equity. Janice, please don't be mad at me. Thank you does not seem like enough to honor you, Janice. Instead, we will commit to walk the talk as you have done and achieve housing justice. Janice knows uniquely that housing is health, that our multi-sector approach to preventing and ending homelessness must include health funders and advocates. So before I introduce our plenary speaker, Janice, will you please stand and be recognized? So Dr. Megan Sandel is an associate professor of pediatrics at the Boston University School of Medicine, the former director of pediatric healthcare for the homeless at Boston Medical Center, a co-principal investigator with Children's HealthWatch, and a nationally recognized expert on housing and child health. She published with other doctors at Boston Medical Center a national report on how housing affected child health based on the Doc for Kids project, and was author of There's No Place Like Home, a report documenting how asthma, lead, injuries, homelessness, food insecurity, chronic disease, and educational attainment were all affected by housing. She was a co-principal investigator of the Boston Healthy Homes Partnership, a study to determine if housing changes improve the health of children with asthma. And I know she's probably, like Janice, an advocate for housing and health justice. Please welcome Dr. Megan Sandel.
Thank you so much for having me today. I want to particularly thank Nan and the entire National Alliance to End Homelessness family. I have to give a particular shout out to many friends that have taught me a lot around homelessness. People like Boston Healthcare for the Homeless, Dr. Jesse Gaeta, Barry Bach, Jim O'Connell, Pine Street Inn's Lindia Downey, and Mass Housing Shelter Alliance, Joe Finn, among others, that I think has really helped me particularly understand how kind of housing and health are connected. In many ways, I think good keynotes speakers tell you the arc of the talk ahead of time, right? They say, this is what we're going to talk about, and then you can kind of track their progress. I don't have to tell many of you around kind of why social factors drive health. You guys see that every day in your work. But what I'm going to try and focus on today is where I think the depth and the breadth of the ways in which social drivers impact health and development becomes really important. And I want to try and make sure, particularly to arm you as you go up to Capitol Hill later today, to try and drive that home, because I don't think it's always apparent to everyone. I want to talk a little bit about why my sector, the healthcare sector, which is a little late to the social determinants of health party, is now really engaged. And I think these are really important opportunities. And then finally, I want to talk about how do we partner together to really end homelessness, address housing instability. That is kind of our challenge right now, and I think we can really do it together. So on this first slide, I think I like to really drive home a couple of points of why social factors are so important to housing and health. The first is really, I think, as we recognize that health care alone does not really actually impact your health that much, right? 10 to 20% of health outcomes are driven by health care. Genetics play maybe another 10 or 20%, but 60 to 80% of health outcomes are driven by where you live and what your social and behaviors are. And so those factors become where we can achieve health equity. What becomes, I think, unfortunate, though, is when we talk about social determinants of health, we sometimes imply that other people have social determinants of health, that we don't have social determinants of health. And I think, really, we all have social factors that drive our health. It's a story of us. We all have them. What I like to say is my children have spectacular social drivers of health. They have two parents that are doctors, and we live in a house we own in a neighborhood that is safe and that they go to a great school. And so I think it's really important as we talk about it to talk about social drivers as being something we all have to face and that are things that are changeable and ways in which we can improve health outcomes. The second I think is really important is we tend to talk about them only negatively, right? You're homeless, or you're housing unstable, you're food insecure, or you don't have a job. When we don't, I think, talk enough about the enabling factors, the positive social drivers of health. You belong to a church. You have a social network that supports you. You're in a place where you can see greenery and light. There are ways in which you can be able to cope with certain types of stresses. And I think that as we think about what housing and means to people, I think we have to talk about changing people's life course, both by taking away the negative factors, but also promoting the positive factors that are really essential to how we are able to change people's life course at any point. And I think that that becomes, I think, a really important part of social factors. The third piece that I think becomes important, and as this kind of pictorial tries to illustrate, is that, social drivers don't happen in isolation. Right? We tend to always want to try and test them as such. I'm going to do a food intervention. I'm going to give people a grocery card, or I'm going to give them a bag of food, or maybe even a medically tailored meal. When you think about it, if you're not accounting for other social factors, you may undermine it. In that way, I think that, sometimes I will argue a bit that housing ends up as not the only social driver of health, but it may be the primal one, right? Your food intervention is not going to work very well. Your employment intervention, your education intervention won't work if you're homeless or housing unstable. And so as we think about it, I think we have to get comfort in, are there ways in which we can talk about these together? Can we intervene in multiple ways in order to help change people's life course and move them forward? It's really not an isolated factor. It's also not necessarily an all or nothing factor, right? You can house someone and they can still be housing unstable. And it doesn't really happen in a continuum, as I am going to show you in a minute. There are ways in which I think that we have to understand the full complexity of how social factors influence health. For those that aren't familiar, Children's HealthWatch is a research policy network based out of Boston Medical Center, but we actually collect data in 5 cities, Boston, Baltimore, Philadelphia, Little Rock, and Minneapolis. And we focus on young children, kids 0 to 4 years of age, because that's when you're growing the body and brain you need for the rest of your life. And policies really impact key hardships: housing instability, food insecurity, energy insecurity, and healthcare cost trade-offs. We really believe that those hardships are able to be alleviated by policies, and that you can change the health and development of kids and their families through alleviating those economic hardships. So last year, we actually published an article, and this is a graph out of that article in Pediatrics, looking at 3 forms of housing instability and how they impacted child health. I think what's important is that we actually looked not just at child health, but we looked at caregiver health. Because let's be real, getting someone a home isn't just an individual level intervention, it's someone that affects everyone that lives in that household. Yeah, thank you. And so the colors on the graph I just want you to focus on is there are 3 different factors we looked at. We looked at homelessness, which is the yellow bar. We looked at multiple moves. So you may not be homeless, you're actually moving frequently. And then the purple bar is behind on rent. And all 3 of those forms were affecting child and caregiver health. I just want you to note, though, there were a couple of surprising things we found. We found that 1/3 of low-income renter families in our sample had a form of housing instability. It was super common. And we found that there wasn't a lot of overlap between them. If you were positive for one form of housing instability, you were only positive for that one form 86% of the time. So it wasn't that you were shifting between being behind on rent, multiple moves, and homelessness. Those were kind of distinct groups. But here's the real kicker, is that as we think about it, we all know that homelessness can make people sick. But the issue is that behind on rent and multiple moves looked just as bad. And so as we think about it, getting someone a home, if they're still having to move frequently afterwards, or if they're falling behind on rent, they may still have those health outcomes. We see that you impacts whether or not you have a 4-fold risk of being food insecure, or a threefold risk of having to make a healthcare cost trade-off. And so we talk a lot about healthcare coverage as a route to health, but I actually think it may be a home than actually maybe the prescription we need to write. So as we think about it, we actually tried to put a number on this. We said all the millions of families out there that are either homeless, housing unstable, moving frequently, or behind on rent, we actually think that there is $111 billion of avoidable costs over the next 10 years if we house every unstable family. And those are numbers that I want you to take when you go up to Capitol Hill to talk about, because we talk about how this may cost too much, but we don't talk about all the costs that we can avoid in the future. So I want to shift gears and talk a little bit about why does healthcare now really come to this? And I think what I say is we can't afford not to. And the reason for that is that we know that there are a lot of costs associated with unstable housing and homelessness. Where it becomes interesting is now we're on the hook for a lot of those outcomes. We used to be paid in this kind of fee-for-service way, where if you were sick, we charged a fee for the service and we got paid. And now we're in more of what are called value-based systems, where we have a pot of money to take care of people. And the reality is that unfortunately, what we see is that there's a lot of people that are sick because of their homelessness and housing instability. So this is from my hospital, Boston Medical Center, where a full 3% of our total population accounts for 40% of the costs. And when we look at that 40%, half of them are homeless and housing unstable. And so what that means for us is that we can do the best case management. We can try and send visiting nurses out to check on people, but if they can't find them, they're not going to be very successful. And so for us to be successful as a health system, we need to start looking at where you live and being able to stabilize your housing situation in order to make you healthier. As we think about that, healthcare has many dollars that it can bring to the table, not just dollars to pay for services, but we can bring things like community benefit dollars. We can bring investment dollars to try and do that. And so 2 years ago, my hospital system actually invested $6.5 million in trying to create and sustain more affordable housing in the Boston area. You've seen now this more and more. Kaiser has committed $200 million. Metro Health has put $60 million. Intermountain is setting aside somewhere upwards of $120 million. These are all ways in which healthcare is acknowledging we know housing and health are related. We think we actually may need to play a role in how that can be solved, but we know we're not going to do this alone, right? We are not at Boston Medical Center building our own housing, right? We're not going to become a landlord. We're going to invest in key partnerships as ways so that we can address this and be able to be the partner to all of you so that we can end homelessness and housing instability. As we think about that, I think more and more there are ways in which we can do that. We can partner with local CDCs to actually create new housing units, invest in the community development corporations, not the Centers for Disease Control that my sector thinks. We can do things like invest in grocery stores in neighborhoods where you wouldn't be able to go to a bank to get that loan, but maybe we can give a low-interest loan to attract a new grocery store on the first floor of affordable housing development. We can actually pay for on-site services, ways in which people can be stabilized in housing and do better in all forms of supportive housing, not just permanent supportive housing, but in other ways to help people change people's life's course. And we can really be part of community-driven solutions. I just want to really echo that we think people with lived experience hold the solutions to many of these issues. So $1 million of our $6.5 million are driven towards an innovative stable housing initiative that actually invests in resident-led grant making, so that would be ways in which you can actually drive changes on your own. What's exciting about that work is that in Boston, actually, Boston Children's Hospital and Brigham and Women's actually matched our contributions. And so these are ways in which we start to think about what are the policy level work, not just the individual level work, but the policy level work that we can do together. Where I sometimes will talk is the kind of in the proverbial downstream, upstream, and I think that sometimes people talk about it as a choice. You either work downstream or you work upstream. And I think it's really essential that if we are truly going to end homelessness and housing instability, we have to make it an and. It really is important, and I think particularly I'm excited to have been the keynote before you guys go up to Capitol Hill. I want you to tell stories of your work because you all are doing amazing things helping people that are really suffering a lot at the downstream effects of homelessness and housing instability. And I think that is a powerful story. Where I want to urge you is to make sure that when you tell that story, you also pivot to talk about needing to fix the systems and policies upstream that have created the homelessness that we are treating. There are amazing solutions out there. It's the reason why Children's HealthWatch, the National Alliance to End Homelessness, the National Low-Income Housing Coalition joined together in a cross-sector coalition called Opportunity Starts at Home, where those systemic fixes are simple things like investing more in affordable housing, in vouchers that help people be able to pay the rent, in emergency stabilization that prevent people from becoming homeless in the first place. Those are policies that are ready to go, and those are things that you can talk about as ways that create the systems that are needed in order to address these underlying problems. I would just like to end and be able to thank you with kind of my last slide. And I was really happy yesterday that part of the keynote talked about equity, because this slide, when people have heard me talk before, is pretty much the slide that I use to end every talk I give now. And I think that what's important, and this pictorial is one that I like to use. Many people have seen other pictorials. There's one with people looking over a fence at a baseball game and then eliminating the fence. I also like the one that Robert Wood Johnson is using around people with different size bikes, and in particularly the ableism focus on this. But I like this one because I think people can look at it and draw it later, and it can drive home kind of why equality and equity are not the same thing. I think that as we think about trying to fight for equality, which we should, the side of the cartoon that has the three different heighted people kind of illustrates why equality may not be enough, right? So the equality side, you have a tall person, a median height person, and a short person, and they all get equal treatment. They all get one box to stand on. And in that, the tall person gets to that apple of opportunity in the tree, right? And the medium height person gets a little closer. The short person gets closer, but it's still pretty far off. It's only when you treat people equitably, you give people what they need in order to be successful, that they all get that same fair shot at the apple of opportunity in the tree. The tall person gets one box. The medium height person gets 2 boxes. The short person gets 3 boxes. The reason I think it's important is that the tension with equity is that in order for everyone to get that same equal fair shot, you have to give some people more. You have to treat them unequally. And it has to acknowledge that people didn't get to be different heights by accident. Structural and systemic racism are the results of why people are starting from different places. And so we have to be comfortable with arguing. The good news is that in a lot of ways, this is the conversation of our time. Are there ways in which we can drive equitable development? We can undo many of the structural policies that frankly perpetuate things like redlining and other things. And these are ways in which people don't have to stay the same height. People can grow and change, and that is their life course that we can impact. And so while talent is equally distributed, opportunity is not. And this is our way in which we can undo these systems and create the future. So with that, I just want to thank you for your attention today, and good luck today on the Hill.
Well, I just want to really thank Megan. You know, her leadership on this issue has been so important nationally. She really has helped to bring the healthcare sector along to recognize the importance of housing, and she really has been a key partner with us. As she said, we've worked together with the National Low-Income Housing Coalition, the Center on Budget and Policy Priorities, and the support of the Melville Charitable Trust to start Opportunity Starts at Home, and I think we've talked about that before. We also have you're going to hear about another coalition effort that we're part of, also on housing, trying to get to those upstream issues as well today. But just thank you so much to Megan for her extraordinary leadership across all of these sectors. So much appreciated. And it's now my pleasure to introduce another great partner of all of yours and certainly ours, and that is Jemine Bryon. She's Deputy Assistant Secretary for Special Needs Housing at HUD, in charge of all of our homeless programs. Jemine.
Good afternoon, everyone. It is my honor to have the opportunity to speak briefly with you today. First, thank you and congratulations to the National Alliance for another extremely successful conference. These last 2.5 days have been so incredibly informative and most valuable for the networking opportunity that it has presented. While there is much data to support the great work you are doing out in the communities, your presence here further demonstrates your commitment to ending homelessness in the United States. In the opening plenary, Nan did an amazing job highlighting the data on the current state of homelessness. At the sessions, you heard some incredible presentations highlighting innovations, strategies, and programs that are being implemented in communities. Many of you also attended the various HUD sessions as well, wherein you were provided with some federal updates. So all I want to say as I stand here before you, as the team in front of the curtain, is we are committed to housing first. Thank you. We are committed to housing first. We continue to provide incentives to COCs and projects that adopt a housing first approach. COCs are expected to prioritize projects based on data and evidence, including cost effectiveness and outcome measures. The flexibility that has been added to the 2019 COC NOFA will allow for service participation requirements, but only after a program participant has stabilized in housing. To be clear, service participation is to help move the stably housed towards employment, increased income, substance use treatment, and strengthening of social connections. The use of evidence-based approaches is the priority. Use what works. Use what improves the lives of those we serve. We are committed to making gains in your community's collective capacity to use data. A perfect example of this, and I hope you were able to see the presentations, is Stella and its use of longitudinal systems analysis. You will be able to use Stella to analyze performance and develop important strategies. Also, keep your eyes out for the announcement of the final awards for the HMIS Capacity Building NOFA. Approximately 34 communities will receive funding to help facilitate big improvements in their data collection and setting them up to make more data-informed decisions about their systems of care. We are committed to targeting and driving our work to the hardest to serve. Those living in unsheltered situations are particularly vulnerable. The solution will involve long-term and repeated investments, as well as rigorous utilization of best practices and continued innovation. It will also depend, in many of our communities, upon systemic and significant efforts to ramp up affordable housing. HUD and our partners at USICH and the Alliance are working together with several communities with high rates of increases in the unsheltered homelessness. We will develop and adopt best practices and innovative practices. We plan to share the learnings with communities and providers all across the country to help them address their own crisis. We are committed to the protections of the equal access rules for all. Yes. The fact is, the LGBTQ individuals are overrepresented in the population experiencing homelessness. And we know that transgender individuals in particular face the greatest challenges when they present at shelters. This is not okay, and we will work with you to ensure our shelters and our housing projects do not discriminate and are able to meet the needs of all individuals. Our expectations have not changed. We are committed to our young people who are at risk of or are facing homelessness. The Youth Homeless Demonstration Program has and will result in some amazing work. Round 1 communities are up and running and are projected to serve about 1,500 youth. 1,300 of those youth will be served with permanent housing. And we have 4 projects that are concentrated on serving LGBTQ youth. Round 2 communities are finalizing their projects, and preliminarily, it looks like 547 new units of housing will be created amongst those grantees. The largest number of awards under YHDP will be Round 3. We are planning to announce those awards to 25 communities within the next 4 to 6 weeks. And please, keep your eyes out for the next NOFA for YHDP that we hope to publish in the next few months. This Round 4 will make $75 million available to another 25 communities. Absolutely. We are committed to addressing the needs of survivors of human trafficking. Please take a look at the NOFA that is out right now. Program applications are due by October 30th. This is going to present a great opportunity for DOJ and HUD grantees to work together. We are committed to continuing the critical work to recognize and address the unique issues and needs to combat homelessness in our rural communities. And we are committed to ensuring racial disparities are assessed and addressed in the delivery of homeless services. Last year's competition was the first year we asked COCs to assess their data and determine if there were racial disparities in their system. As you have seen in the 2019 NOFA, we are further incentivizing necessary work in this area. Thanks to the many communities that are doing great work to ensure there is equity in their system. Ladies and gentlemen, the respect and commitment that my team and I have for you and the people we serve is immense. You are working hard, we are working hard. With the voices of people with lived experience, love in our hearts, and a continuing commitment, we can and will do more until homelessness in the United States of America is no more. Thank you.
Well, I just do want to say that we are so lucky to have Jemine and Norm and the staff in the SNAP's office on our side, making sure that we have these programs and that the programs, we can use the resources to do the smartest things possible. So it's hard work, and we just want you to know that we're very, very grateful for it. It's my pleasure now to introduce Clarence Anthony, who's the CEO of the National League of Cities. The National League of Cities is also involved with us in the Opportunity Starts at Home campaign on the steering committee, and they're leading another effort with mayors and CEOs that we're part of as well to try to get more affordable housing in the nation. We appreciate, and of course, all of their members are struggling with these things. So it's my pleasure to introduce to you now Clarence Anthony.
Somebody said it couldn't be done, but he with a chuckle replied that maybe it couldn't, but he'd be one that wouldn't say so till he tried. So he just buckled in with a bit of a grin on his face and took off his coat and went to it and started to sing as he tackled a thing that couldn't be done, and he did it. There are thousands to tell us we cannot end homelessness in America. There's thousands to prophesy failure. There's thousands to point out to us one by one the dangers that wait to assail us. But we got to buckle in with a bit of a grin on our face and take off our coat and go to it. And started to sing as we tackle the thing that couldn't be done. And we can do this. Can't we do it? Can't we end homelessness? And let me tell you, it is our time. It is our time now. Let's not get distracted by the things that are going on the Hill today about reports. Let's not get distracted by the other things that are going on in Washington, D.C. Are y'all ready to lobby today? Are you ready to go to the Hill and tell them, as Megan's indicated, the stories about people who are living in our city every day looking for a place that they call home? I travel around America every week in cities, Miami, LA, Seattle, Minneapolis, West Palm Beach, Florida, all of those communities. And just like you, I see the faces. I see the faces of people who have lost hope, the faces of people who may have had challenges in their lives and just haven't found their home. And it hurts. And that's why the National League of Cities and mayors all over America, when I ask them this one question, what is keeping you up at night? Most often is this housing and homelessness. Most often is housing and homelessness. It's access, affordability, quality, and equity in housing in American cities. So I say that to you because I want you to know that you have a partner with mayors. You have a partner with CEOs who also are interested in trying to address these issues. You have partners in churches, nonprofits. We're not alone as we address the housing and homelessness challenges in America. You know, when we think about it, sometimes we don't make the challenge real. The real thing is, if you don't have a place to live, you don't have a place to have dinner with your family and have those conversations with your kids or your spouse. You don't have a place where you get up, I just want to use the bathroom. Just basic things that we don't think about. When it rains, when it snows, we don't have a place with a roof on it. And to me, that hurts my heart. That challenges me every day in my job, in my role, to push mayors and council members to understand that to have a home is the start of what America tells you you can achieve. To have that picket fence or to have a place you can drive your car up to. Aren't those just basic things? And as you talk today to your congressional members and your senators, talk in plain language. Talk about the roads that just people drive up on to their homes and how their kids are playing in the yard. Close your eyes and imagine what a home is and tell them what we are struggling with in our cities and that we don't have time for those other distractions that's happening in the conversation in America right now. Mayors, council members, local leaders want to partner with you. They want to be a part of the solution. And that's why I'm appreciative that Nan, thank you so much for inviting me to have these few moments to talk about a real alliance between the Alliance, the National League of Cities, and the mayors and CEOs looking for housing investment. Now, the National League of Cities is an organization made of mayors, council members, local leaders all over America. And last week, we released the report because of the issue of housing and the lack of affordable and quality housing in our country. And the fact that people now in Washington, D.C., and L.A., Chicago, all over America can't afford a home. They can't afford that American dream. So we provided some recommendations, solutions, and real examples of how cities can implement strategies that can provide housing to their citizens. I hope that you all will look at that report, but not only look at it, second, read it. The third, I want you to go to your mayor's office, your city council members, as an alliance leader, and say, we need to work on this. You need to demand that we need to work together on these issues at the local level. Because otherwise, what's going to happen, and thank you for the amen, brother, I appreciate that. Otherwise, what's going to happen, what they would start focusing on the other things, the budget, potholes. But homelessness and housing deserves that same focus. We need a partnership with you to make it happen. Now, coalitions are important. And I talked briefly a little bit about NLC is proud to be a founding partner of mayors and CEOs for U.S. housing investment, of which the Alliance is also a first stakeholder partner as well. This is a coalition of 21 bipartisan mayors because on the local level, we don't care if you're Democrat or Republican. It doesn't matter. Because when a fire truck comes or a police come, do you ask, are you a Republican or a Democrat? No, you just want the fire to be put out, right? So we got a bipartisan group, top business and nonprofit leaders who's on the front line of making sure that this housing crisis is solved. The homelessness issues are addressed and solved. Together, we can do this if we work hand in hand. But the other thing I want to make sure I leave you with is that we need a federal partner. The public sector on the local level can do it and talk about it. The private sector can put dollars, but the federal government has also have to continue to make sure that they are at the table as well as we address this issue. And this is one of the reasons why you're in Washington, D.C. I'm reminded about this partnership that we need every day by our campaign manager for mayors and CEOs, and Eva Toole is here, who pushes us every day to remember that we can't do it alone. We need a federal partner. What do we need from our federal government as we address this issue? And I said, somebody said it couldn't be done and you can do it. Well, we need them to support a couple of bills that's out there. The first is fighting homelessness through services and the Housing Act. That act itself would authorize $750 million in grants for local communities to fight homelessness. $750 million. The second is a bill that is being developed and hasn't been introduced. It is to establish a housing stabilization fund. That would award grants as well to local communities to address homelessness. Now, I talk about those two pieces of policy because a lot of times, even when I take mayors and council members to meet congressional members, they get distracted. And I'm just going to be straight with y'all. They get distracted. They go in and they start taking pictures, smiling and tweeting and Snoop chapping and snap chapping or whatever they all do. I'm sorry, Courtney, I'm still learning. I'm still saying pound NLC. And they said, no, hashtag. It's a pound. You can get distracted. You can stand up there and you can start taking these photos and you only have 5 minutes and y'all sit down and they say, how are things down home? And they start talking to you. Next thing you know, the meeting's over. You got your picture. You've Snapchatted it out. You've tweeted it out. But you have not talked about not one piece of legislation. You've not told one story yet. So my point is, we need folks in the game, y'all. We need you to go up on the hill and don't get distracted. Take your picture after you've said what you got to say. Get your picture. I'm not mad at you, get your picture. If you want one with me, I'm available. But before you get that picture, get your point out. And as I tell my members, bring the authentic you to the conversation. Put your livable experience that you talk about. Share about the people that you see every day that we don't look at on our streets here in Washington, D.C. Talk about the mothers that you see on the street in the tents under the bridges with their kids that we don't look at and we look by. Don't miss out on this opportunity. I had a chance to see the play Hamilton. And one of the songs they have is not throwing away your shot. They talk about not throwing away your shot. This is our shot. This is our chance to go on the hill and tell the stories and to make sure that we deliver the message in a way that it's personal, not political. That it's personal, not political. Don't worry about whether they're Democrat or Republican. Don't get distracted by the things that don't matter. Let's hone in and take our shot today. Now, you may ask, and I hesitated in doing this and saying this, you may ask why I feel so strongly about it. I used to be a mayor in South Bay, Florida, rural community, Belle Glade. All right, the muck. And growing up in this rural community, I just started thinking about this as I started preparing for this speech. I used to remember my aunts and cousins all moving in with us for about 6 months. And it didn't dawn on me that the reason they were moving in with us was that they could have been homeless. One paycheck. So they would move in with us and then they'd go back out. We would move in with our aunts and uncles because we had that rural community network. But the one memory that hit me most, there was this guy named Bill. He had 6 kids, and every Saturday morning, he would work all week hard. Every Saturday morning, his family would wake up, and he would be in the car. He's drunk, wasted all of the money that he had worked hard for all week long. This went on for about 10 years. He and his wife would argue all the time about his challenge. Eventually, it just wore on him. I mean, he was in a job where he had to call white men who were 20 years old in the celery fields, Mr. Charles, Mr. John. He would work 3 and 4 jobs, come home, wasn't feeling empowered. And eventually, he left his family, and he ended up on the streets. His family would reach out to him and try to help him. He ended up working at this and living at this laundromat. And eventually, he lost connection with his kids. His kids were president of the student body, graduated high school, they went on and was very successful. One of his kids even became mayor of his city. And I tell you that story because for a long time, I blamed my dad. I didn't talk to my dad until I realized that it wasn't his fault. I had to pray, I had to forgive, and I had to turn it into something positive. There are a lot of other stories just like that. We would get my dad home for about 6 months, and then he would go back out. And it was very, very tough on our family. And he basically, when he died homeless, sleeping in that same laundromat. We knew where to find him all the time. We'd go there and sit there and talk, and I'm the mayor. I could not save my dad. So, you think that this ain't real? It's real, y'all. And we need to go up on that hill and make sure that we understand that there's a lot of Clarences. There's a lot of Bill Anthonys. And it does impact the family. So I don't want to leave you with a negative feeling, because I'm blessed. I was able to overcome that. I was still able to love my dad. I was able to understand how an African American man at that time was struggling with the old manhood word. Some of y'all don't understand the Southern way, but the manhood that he did not feel. Sometimes I could still see him in the living room with his head down. But guess what? He touched a young man, and all of my brothers and sisters are successful. He was able to show us, though, whenever I went to talk with him, he said, "I'm so proud of you. You can do better than I am. You need to watch out for drugs. You need to watch out for alcohol. You need to get a family. You need to make sure you work hard." And he would always end with, "You know I love you." And this is Southern. He said, "Clarence." Some of y'all know what I mean. We also did it in this room. But he said, I love you, Clarence. And I would say, "I love you too, Dad." Guys, we got work to do. And somebody said it can't be done, but we can do it. We got to take off our coat and go to it. And today is the start of that day. So let's charge the hill. Y'all ready? Thank you all very much. Have a great day.
Thank you, Clarence. I know that's a difficult story to share. It's a powerful message to us, so we appreciate that very much. I want to thank you all for being here at the conference. I have a few announcements, and then I'll just share a couple of reflections about what I've heard here. And we'll have lunch and send you off to the Hill. It's a little bit difficult to launch into the announcement about the name tag after hearing that story. Just give me a second to recalibrate. Turn in your name badges at the registration desk, but feel free to keep your lanyards. The solutions, we're going to have our West Coast Conference again this year on individual adults. That's going to be February 19 to 21 in Oakland at, it'll be fun in a way, at the Oakland Marriott City Center. And our 2020 might want to write down the dates because I don't think they're going to be on the website for months. The 2020 National Conference will be July 13th through 15th here in Washington, D.C. here at the Marriott Wardman Park. I want to ask you to join me. We had 40 volunteers working with us on the conference this year. The volunteers help us do registration, so many other things, and that frees up the staff to be with you in the workshops and for us to be learning from you about what's going on. Will you please join me in thanking those 40 volunteers that helped us out? And also, the Alliance staff are really, we do all of this conference in-house. David and Katie and and Shalom and other people on the team do the logistics and so forth, and all of us work on the workshops, getting all the speakers and topics and everything else. And we think that this gives us a better quality of conference for you, but it is a lot of work for everybody every year. So I just want to ask you, wait 1 second, I'm going to read off the names of the staff people and ask them to stand, and then if you could join me in thanking them for all the incredible, I will say that I do not do any of the workshops, so I will join you in thanking them for the incredible work that they do in putting this conference together. Shalom, Steve, Jasper, please stand up if you're in here, I can't see. Lindsay, David, Chandra, Mindy, Christy, gonna take a minute, Ben, Kay, Cynthia, I know you're there, Joy, Jackie, Katie, Rashida, John, Sharon, Tom, Helen, Andrea, Sachi, Kelly, Preston, and Alec. Will everybody please stand and let's give them a hand. Thank you all. Fantastic job as usual. A few sort of random observations, if I can just take a moment with you of what I have heard and some of the other staff people, some of the themes or things that stuck out to us in the conference. Affordable housing, of course, is always an issue at this conference, but that seems to be even more so. It seems to be the issue this time, how to get people into affordable housing. I think that's also why we wanted to share with you the work of mayors and CEOs for U.S. affordable housing and the Opportunity Starts at Home campaign. We're all working to try to get more affordable housing. It is on the, does seem to be rising, as I talked about earlier in the presidential race and in the concerns of mayors and local elected officials. I have to just, reflecting on what Clarence said, though, I just did have a thought. You said, at the local level, we don't care. It doesn't matter if you're a Democrat or a Republican because you got to put the, whoever's coming to put the fire out, you're not going to ask them what party. But don't you, on the other hand, don't we have a fire going on here around homelessness, and shouldn't we be able to expect that Democrat or Republican people up on the Hill would try to solve this problem for us? It's kind of depressing, isn't it, that we don't feel the same way about members of Congress, that they should be responsible for solving the problems. For those of you who are going up to the Hill this afternoon, I think hold them accountable. That's their job, is to solve these problems for us and not just to fight with each other. Excuse me for the digression. Another thing that came up a lot today was housing first. There doesn't seem to be any concern here that housing first is going to get dropped because there are threats to that from places in the administration. And much more so is people trying to figure out how to do it and what it means, and a lot of commitment to the fact that it works, so more delving into the details. sort of a similar thing is, I think, the increasing realization that a lot of people are not doing, well, not a lot, but there are cases in which people are not doing that well in the homeless system, including the whole unsheltered homelessness phenomenon that's growing, because of barriers that we put up in our programs, or our failure to provide programs that are delivering what it is that people want from the programs. And I was at a meeting earlier, or I guess last week, with the heads of a number of law enforcement agencies, police and police chiefs, and they were having the same realization that from the law enforcement side of things, the punitive kinds of actions, the coercive actions, just don't work with people, and that we need to do more to try to help meet their needs. So that was another theme that I think I've heard today, that we need to look for our barriers and not be about coercion on our side, but be about making sure we know what it is that people need so that we can help them. Race equity, obviously a very big issue, and I think what I heard there was, that is really challenging work, as Amanda said, but we cannot be afraid of that work. Even though it is difficult, there are difficult conversations to have, but we have to have those conversations. And that this is not something that can just be done by white people, and it's not something that can just be done by black people. And white people need to not be afraid to engage in the conversation. We have to do this, we have to take this on and do it together if we're gonna solve the problem. So that's another theme that came out. Another thing was, I think, much more sophistication about reaching out to partners. A lot of these problems, particularly these healthcare-related problems, and so it's so good to have Megan here, but the aging and unsheltered problems, these are public health problems and healthcare problems. These are not homeless problems. We can't solve them. You're partnering with people. I heard a lot more of that. Reaching out to the systems that do have the resources to do this, and it takes a lot of persistence, and Megan also talked about this. It takes a lot of resilience, but it's happening more. That is going to be essential, I think, to us solving the problem. Another thing is using your data. Use your data. You have some new tools now with Stella and other things. You got to use your data to get. We don't have enough money, so we have to be smart about every penny. And the aging, big issue for everybody in the shelter system, permanent supportive housing, on the street. We haven't solved that. We got to really push hard to figure out what's needed there. I don't know if Joe Weisbord is still here, so he can correct me if this is wrong, but Joe has been involved in this issue for a very long time. He has been working at Fannie Mae. He, I think, said yesterday that less than 1% of the housing stock in the nation has universal design. I mean, people in our housing and shelters and everything get hurt who are older because just because of how the housing is configured, can't use it. So, anyway, those are sort of random things that stuck out to me and some of the other people on the staff. We have a lot of very serious problems. You really, really. I hope you were inspired by Clarence and Megan's words to go to the Hill. We really need your voices explaining to people on the Hill what's going on and making sure that they understand their responsibility to do something about it. I want to thank you again, everybody who's here, for coming. I thank you so much for the work you're doing. It's just extraordinary, the things that people came up to me and told me that they're doing. Way ahead, I think, of where we were last year. Just so grateful to you for all that you do. And we're very, very grateful to be partners with yours and that you came to the conference. We hope very much that you enjoyed it. If you didn't, please tell us how we can make it work better for you. And let me finally just ask us all to give a hand to the people here in the hotel who have served us and helped us and made this such a pleasant experience for us. And with that, thank you and enjoy your lunch.